Hey everybody, welcome to this week's episode of Red Pill Your Healthcast. My name is Dr. Charlie Fagenholz here with Lauren Johnson, and we are going to answer five more questions. So let's see which one we're going with first. Here we are. I wish I had found you guys sooner. I spent 6 months trying to heal my gut on my own before getting pregnant. I was unsuccessful and grew discouraged. We ended up getting pregnant immediately. I'm currently 11 weeks, and I'm wondering if it's worth it or possible to continue to try to combat small intestine fungal and bacterial overgrowth while pregnant. I don't want to pass it on to the baby. It's a good question. What do you think?
It's a really good question. And I think it's a question that a lot of moms struggle with in the holistic world. Once they know about all these things, they think, oh, I shouldn't have gotten pregnant. I should have waited to have kids. I should have prepped more. And I also think we have to come to a point where you just trust and you have greater trust and peace about it. Like I trust that ultimately what is going to happen is should will happen
Mhm.
and I don't have any qualms about it. I mean, I could say the same thing. I was on 5 medications with both of my previous pregnancies. And so I think that you can only control what you can control, and what's going to happen will happen, and what's meant to happen will. And I trust in God's protection and God's providence, and and that doesn't mean it's gonna be perfect, or that no health problems are gonna come up. To me, it just means that in the midst of it, I'm learning something. There is goodness that is coming from even the hard things.
Mm.
And so I don't worry about that. But from a physical standpoint, like the medical standpoint, absolutely, there are things that you can be doing during pregnancy that will help to support your baby and help to support you. And then also, Charlie and I were talking about this before we started recording. I saw a question about a mom that had mold and Lyme, and she was struggling with whether or not she should breastfeed her baby because she was afraid she would pass on these issues to her baby. And it's the same thing goes with that. It's like how like there's so much we can do to help support our babies when we're pregnant and when we're nursing. There are certain things you can take, and there's certain things you can do to support a baby, and the antibody protection and all the nutrients, and there's so much you're giving baby in that breast milk that's not necessarily, it's not going to be in formula.
Yeah.
And that you can't necessarily give a baby directly that is taking formula. You can't give a baby that's 3 months old some of these things. You can do some, but I mean, it's you can do a lot more if you're breastfeeding. And
Yeah.
so I absolutely support moms being pregnant and breastfeeding. If you can detox and do some things beforehand, of course. But if it doesn't happen, I don't think you should have uh any
Guilt.
concerns about it. Yeah, or guilt, shame, anything like that. What are your
Yeah.
thoughts?
I 100% agree. This kind of goes along the lines of where, a lot of people say never detox while you're pregnant or breastfeeding. There's a lot of naturopaths that will say that and functional med people. I just don't agree with that. I think that if you use gentle herbs, like you're totally fine. You don't have to do these deep dive liver cleanses and these gut cleanses and these harsh herbs. Like there is a time and place for those things. And this is not one of them. And I agree on that, but it doesn't mean that you should shy away or fear away from using gentle herbs that are very easy to do during pregnancy and breastfeeding.
Mhm.
And so, some of my favorites for fungus and SIBO from Supreme, I like Vital Guard Supreme and Scutellaria Supreme. Very gentle herbs. They do so much stuff. Scutellaria does glutathione, which heals the blood-brain barrier in the gut. It helps your lymph move. It helps regenerate nerves. It helps you sleep. Chrysanthemum is what Vital Guard is, and that's an adrenal herb. That's good for the eyes. There's a lot of medicinal benefits to them, and I don't have ever seen an issue with people using them pregnant or breastfeeding. Now, if you're going more towards Vervita, black cumin oil, which is something that I have a lot of people take during pregnancy for blood sugar regulation and all that, that's antibacterial and antifungal. Cleanse Plus is very low dose, broad spectrum herbs. That's fine as well. If you don't want to take as many as many nutrients because Cleanse Plus is a mixture, then stick with the single herbs from Vervita, or excuse me, from Supreme if that makes you feel more comfortable. So I think it's very, very doable. It's not harsh like doing, like a Golden Thread Morinda Malia combination. You're just going at it from a little gentler approach, and it still can be very effective.
Absolutely. And there's so much also that you can do with emotional work and
Hmm.
nervous system work. That baby is connected to you. That I really don't, I think you should also just consider that to be just as helpful too. There are so many things that we can do and give our babies, um, being pregnant and breastfeeding, that it's well worth it. Um,
Yes.
and yes, pregnancy is a time of stress for the woman's body, but it can also be a time where you are rolling with it and you're taking it in stride and you are saying, okay, this is what God has me for right now, and what can I do to support myself and support my body, and really also support your mind, because
Yep.
let's be honest, pregnancy is a lot of mental game too.
Totally. All right. Next question is how to detox liver. I recently went through IVF.
I love that question. I
Good
love that
question.
question because it is, I know there's a lot of women, IVF is actually a pretty big topic, I feel like lately on Instagram. And I do think that it is a really important topic because there's a lot of women who have gone through it a lot more than, 10 years ago when I
Hmm.
started having babies. And so what are your thoughts on that?
Well, my question would be, are you pregnant right now? Have you already given birth? You know, the herb that really helps IVF because it helps the feedback loops of the physiology of why most people need IVF is berberine. So berberine can really help IVF work. If it's already worked for you, then it's probably not an herb that I would look into. But your question, and that's a liver herb as well, but your question was, what can I do for my liver? And so again, I like Schisandra Supreme. It's the one herb that works on every liver pathway. So I always say for females, if there was one herb I can choose, it would be Schisandra Supreme. It's not that it doesn't work on male livers, but the female liver is there's such a different hormone picture in females that the liver is just a little more sensitive in females, so to speak, is what I would say. And and then if you are pregnant, then something along the lines of like Vervita Circutonic, very gentle, some nutrients in there. Those would probably be what I would do personally. Is there anything else that comes to your mind?
Well, I know a lot of like functional medicine people would say milk thistle, but
Mhm.
and it's a good liver herb, but it is has some estrogenic properties. So like I don't know that that's the first herb that I would use per se. I think doing things like digestive enzymes, and supporting histamine levels is helpful. But I also think like even like a little TUDCA and like some phosphatidylcholine. I use the Body Bio. I think those can be really supportive, and of the liver. I think you could do things like ginger and apple cider vinegar and some good bitters to really just, I mean, I think that there are benefits to all of those things,
Yep.
that are supportive of the liver. But I like a little bit of TUDCA. I think it's personally okay in low doses. Of course, check with your provider. But I love Circutonic. That would probably be my number one liver supportive thing during pregnancy.
Yeah. It's super gentle.
Yeah.
It's a
Yeah.
very gentle supplement. And a lot of the nutrients in there really help with like chemical sensitivities and stuff that would really stress the liver. And so, on top of all this, make sure your blood sugar is balanced. That's a very easy one to control.
Those things
With
I was
the liver.
mentioning, like especially the apple cider vinegar and the ginger, those things do help a lot with blood sugar.
Yeah,
Absolutely, for sure.
totally. All right, next one. Let's go to this one. Reversing vasectomies. So fascinating. My
Yeah.
my my immediate is don't try to reverse it. That's what my immediate is. I would say the less surgery, so to speak, the better for the body. Sometimes I'd rather let sleeping dogs lie. Um, yeah, and I don't know if it's because, you've heard people say that it increases prostate cancer and stuff like that. Or if, you're actually the male's actually having issues with the surgery, like sometimes you'll see that the surgeons will clip like wrong areas, so to speak, and will give them pain or some type of issue. But in general, I haven't treated enough men who have done vasectomies and then had them reversed to say what my experience has been with the reversals. My rule of thumb is the less surgeries on the body, the better.
And less intervention in the body. I get that. I would say it depends on why. Like I have a close family member who's had one reversed and he did fine. And they went on to have two kids and everything was fine. So, but I also would say if you want to have it reversed because you end up wanting to have more kids and you changed your mind, that might be a better reason. But I also would, I don't know. I do think that there can be an issue that comes up when you're interrupting the body again. And so I my approach would, especially if you're doing it just because you're concerned about the health consequences of a vasectomy, I would say let sleeping dogs lie.
Yeah. Yeah. If you're trying to have children again, then I totally understand that.
Yeah.
Like that's now I have had a patient who had a vasectomy and they still got pregnant like twice. Um, so they're not vasectomy is not 100%. It's just a very high percent that you will not get pregnant. Um,
I've
so, but
actually seen that happen several times, where
yeah,
I mean, it's just no guarantee.
no guarantees.
It was like years later, and and then the woman got pregnant. Which I mean, that I think it's more common to happen in the immediate aftermath after a vasectomy, but I think it can still happen other
Yeah.
times too.
All right, next question. Antibiotics during pregnancy, how to prevent poor gut health in baby.
Yeah, you've already mentioned the herb that I would use as Scutellaria.
Yep.
Absolutely would use that. I would use Megaspore. I've used both of those this pregnancy. I've tested for both and I've tested for Vital Guard at different times too. I love all of that stuff. I think Megaspore is a great one to have on hand after like I would say for Group B strep prevention too is like a good probiotic, but also definitely for after antibiotics. And
Yep.
then, I think there's a lot of nervous system support that is really needed after antibiotics. The gut is just super, with the gut bacteria being super sensitive to it can really change like the way you're reacting. And then that can change, of course, that response that changes how you're connecting with baby. And so I would also say to really focus on your nervous system during that time. You can make your own homemade gummies and do like gelatin and things like that that are supportive of the gut lining. And I know a lot of women like aloe during pregnancy. I have not tested for it and it did make me crampy. And so I did not take it. But I think that that would be another good digestive support. But I honestly think even just doing Megaspore and some Scutellaria, which will help with yeast.
Yeah. Yeah, I would say Scutellaria, Vervita Black Cumin Oil, and Megaspore would probably be my top three. And then short chain fatty acids. So I know that Body Bio makes a good one. I also use Apex and Terovite. That's the one I probably use personally the most. But I feel like short chain fatty acids don't get enough love. And the reason why I like them is because it really helps heal the colon lining. And it does so many physiological feedback loops like berberine for blood sugar and for energy production, mitochondria, and all this stuff. And that really helps heal the gut. And it really tackles a lot of gut issues, so to speak. And so those are the top ones that I would do.
Yeah. I haven't taken butyrate during pregnancy. There was some protein folding concern
Hmm.
that I was talking to the body bio director about. And so that's one that they kind of shy away from. I know
Mm.
as a provider, I've seen many providers use it during pregnancy.
Yeah.
And so I think it just depends on you and what you feel is and what you feel like is working for you. And so butyrate's something that I absolutely adore otherwise.
Yeah. Super, super good. All right, last question is if you could only take one multivitamin supplement that included most essential nutrients like magnesium, selenium, potassium, what would it be? This is a good question.
Yeah, especially because you see a lot of multivitamins online, on
Yep.
social media that are really encouraged. And I just my my issue with a lot of the multivitamins that are encouraged online is a lot of times they just have such small amounts
Hmm.
of things that it almost it doesn't really make that much of a difference. I do I don't like the we were talking about this beforehand. I was asking Charlie's thoughts on organ-based multivitamins
Yep.
and how like a lot of women will use beef liver as their prenatal. And I personally don't feel like it's enough. I think it can be a good nourishing thing, and that it can be a helpful thing, but I don't think it would be like considered a multivitamin or a prenatal replacement. So, what are your thoughts on that?
I'm the same on that. I would say I don't view I view organs as a therapeutic supplement. I don't view them as multivitamins. I'm also not huge into true multivitamins only because I know the research says, stuff about them and people will quote the research, but I just haven't found one or really any that consistently tests on a lot of people. And so that's where, I like the concept of it. It's kind of like, I don't know if this is going to go right or wrong, but it makes sense in my head. It kind of reminds me of like vaccines in the standpoint of like, the research says this, even though we know that it's skewed research, but like the research says this, and in theory, it's more so like, yeah, that makes sense. Let's get people immune to these infections. But it looks good on paper, so to speak, unless you read the inserts, and then it doesn't look good on paper with the side effects. But in general, the concept of it is really what I'm getting at is like, yeah, that makes sense. Like you can talk to someone who has no idea about medicine and be like, hey, this is going to get you immune to polio or whatever you're talking about. And it gives them a little bit of it, and then their immune system gets, antibodies towards it, and then we get herd immunity. And without going into what we really know about it, to the outside ears, that sounds good. That makes sense to people. Same thing with multivitamins, where it's like, yeah, we have depleted soils, we have all this stuff, so we have issues in our food supply, and these supplements will supply all of the nutrients for you. It sounds good, but then when you get into clinical practice with it, I have just found that they don't muscle test on people as well as you think they should. That's why I'm comparing it to vaccines because we all know vaccines suck, and you don't have to you know, look at a deeper level of what I just said. I'm just comparing of like how it sounds out loud to someone who has no idea about medicine. Is that fair?
Yeah, yeah. I think I think I like what you're saying because you're saying it makes sense on paper, and that's what a lot of people go by. But you
Yes.
have to consider what the body is doing. And the
Yes.
body was I mean, wonderfully designed. Like it wasn't designed by a human.
Right.
And so it's like you don't know what all is happening and how that is interacting. And that's why vaccines, people just on paper, they don't get it, but it's like it causes other downstream effects. And then multivitamins, there's just so many other factors that I think they don't end up making a huge difference where the body's like, oh, I need that. Oh, that's
Yeah.
really helpful. That's going to help bring my body back into balance. Like it's just not going to be something that actually moves the needle for health. Um,
Yeah.
I, I do think there are like we think about like herb. I think there's some herbs that like like Thera I like Thera when I consider like a multi-nourishing or like supplement like that. Sure, something like that. I mean, like I like bee pollen. I like a lot of different things that I would use kind of in like a nourishing capacity, but it
Yep.
wouldn't necessarily be a multivitamin that's described as a multivitamin. We were talking beforehand. I said, well, what would you choose? And you said Inspiracell and Regenerzine Heart.
Yep.
And I was like, for a woman, a multivitamin, absolutely. My first number one go-to would for almost every probably every woman would be Regenerzine Heart.
Yep. Yeah. And again, like it's the nutrients in there that support your mitochondria. They don't have every single vitamin and mineral. They just don't. Regeneron Heart doesn't. But with the heart tissue, with the adrenal tissue, with the CoQ10, and it has the potassium and some magnesium and selenium and B vitamins and things like that. Like it's about as close to a multi as I will entertain for most people because it really helps the mitochondria. And that is the most important thing, more so than on paper, what it all entails, if that makes sense. It's like just like vaccines, I want them to work properly. I want the concept to work. I wish it did, but it doesn't. And some people will do really well on multis. I'm sure of it. And someone will be listening, say, hey, when I start taking my multi, it helped me so much. And that's great that those ratios really worked for you. I'm just saying, is in general, what I find clinically is that they don't muscle test on people as well as we're led to believe. And I don't think that organs are replacements for multis. That's all I'm saying.
Well, and organs, I think that there is definitely a time and place for them, but
Yes.
I do encourage them from different for different purposes. But so many people struggle with histamine and other issues that
Hmm.
organs in a capsule are not going to be they're going to be something that actually can cause more issues,
Yep.
not. And so, and even like an oyster supplement, I love an oyster supplement, but it's a higher histamine thing. And so, like if you are struggling with that, but you also do need some zinc, you might just need some zinc
Right.
and take it with food. And instead of doing an oyster-based supplement that might produce this histamine reaction and cause further downstream effects.
Yeah. Yeah. So, I mean, I would say, I think it's fair to say we're not hating on multivitamins. We just don't think that there is one multi that's going to be better than the rest, and that we just don't find that people truly need a stereotypical multi most times. And that organ supplements can be really good used therapeutically, but we don't think that they will replace um, they won't be a multi essentially.
Yeah.
That's what we'll say.
Yeah. Yeah. I think that
So
I think that's a good response.
yeah,
And that goes with so many things in, health. It's like there's no black or white answer to this. There's no
right,
yes or no answer because everyone's so different and we all have different needs. But it is general to say like there is no general like yes to to one supplement for everybody.
right.
Everyone needs a multivitamin. Everyone needs a probiotic. That is just not the case.
That's right. All right, that's all the questions for today.
All right. Well, this is not meant to be medical advice. This is meant to be educational. Please speak with your healthcare provider before changing anything.
Thank you all for tuning in, and we'll see you all on the next one.